Welcome back to another deep dive. Today, we're going to be talking about foot and ankle injuries.
Okay.
Specifically, we're going to be looking at things like Achilles tendon injuries, plantar fasciitis, and stress fractures.
Right.
And the source material that we're using for all of this is Chapter 12 from this textbook.
Okay.
All about the aging athlete. And
I was just saying.
by the end of this deep dive, you're going to understand how these injuries happen, but also how doctors diagnose them, how they treat them, and even how to prevent them.
Great. So it's really important for
Jump right in.
active people or people who want to stay active.
Exactly.
Yeah.
So let's start with the Achilles tendon.
Okay.
I know it's the largest tendon in the body.
It is.
But why is it so important for movement?
Well, it's basically your powerhouse for everything from walking to jumping.
Okay.
The Achilles connects your calf muscles to your heel bone.
Okay.
And this lets you point your toes down so you can push off the ground. And without it, simple movements become really difficult.
I see.
Yeah.
And I've heard that these injuries are actually more common than we might think.
They are, yeah. Especially for people who love running and jumping.
Okay.
You know, it's not just about how much you run, though.
Oh.
Your individual biomechanics can come into play, too, like your foot structure, your flexibility.
Okay.
But external factors are important, too.
Like what?
Like what type of shoes you wear,
Okay.
how quickly you increase your training intensity.
So like someone who's been wearing minimalist shoes for years.
Right.
And then suddenly decides to train for a marathon.
Exactly. Yeah, sudden changes like that can really stress the Achilles.
Gotcha.
And age is a factor, too.
How so?
Well, as we get older, the blood supply to the tendon decreases.
Okay.
And this can delay healing if an injury does occur.
Makes sense.
Yeah, that middle section of the tendon in particular, it has a kind of a poor blood supply, making it more vulnerable to injury.
So what if someone thinks they might have an Achilles tendon injury? What are some things they should look out for?
Well, pain is a big one.
Obviously.
Yeah, especially in the back of the heel or the ankle.
Okay.
Especially when you're pushing off the ground.
Gotcha.
You might also feel some stiffness, some swelling, and even like a weakness in the calf.
Interesting. And I've heard that in severe cases, people even hear a pop.
Yeah, that's right.
Like a popping sound.
Yeah, that popping sound at the time of injury, that could indicate a rupture.
What's a rupture?
It's a complete tear of the tendon.
Oh, wow.
But, you know, doctors have a few different ways to figure out what's going on.
Okay.
They can check your range of motion, feel for tenderness.
Oh, okay.
And sometimes they use imaging.
Oh, like an MRI or something?
Right, an MRI or an ultrasound to get a more detailed look.
Gotcha. So let's say someone is diagnosed with an Achilles tendon injury.
Yeah.
What are their treatment options?
Well, luckily, most Achilles tendon injuries can be treated without surgery.
Oh, okay, good. Yeah, it's the RICE-E protocol.
RICE?
Yeah, rest, ice, compression, and elevation.
Oh, okay, I've heard of that.
Yeah, and over-the-counter pain relievers can help too.
Gotcha.
And physical therapy is crucial for strengthening and improving flexibility.
Okay.
There's also some interesting research on eccentric exercises.
Eccentric exercises?
Yeah, where you lengthen the muscle while it's under tension.
Okay.
It seems to help the tendon heal.
Interesting.
Yeah.
So lots of stretching and strengthening.
Yeah, you got it.
Okay.
But for complete ruptures, or for cases where those initial treatments don't work, surgery might be necessary.
And what does that look like?
Well, it usually involves reattaching the torn ends of the tendon.
Okay.
But it can take 9 to 12 months before you're back to full activity.
Wow, that's a long time.
It is, yeah.
Are there any new treatments on the horizon that might speed things up?
There is some promising research on platelet-rich plasma.
Platelet-rich plasma?
Yeah, or POP therapy.
It involves injecting a concentrated solution of platelets,
which are
blood cells that are involved in healing,
okay,
right into the injured tendon.
Interesting.
Yeah, early studies suggest that it might help speed up tissue repair.
Okay.
But we need more research to be sure.
I have to ask about night splints.
Yeah.
I've seen people wearing them, but I don't really know what they do.
Night splints are often recommended for Achilles tendon injuries.
Okay.
Especially at the beginning of treatment.
Okay.
They help keep the ankle slightly stretched overnight, which reduces pain and stiffness in the morning.
Oh.
And allows the tendon to heal properly.
Makes sense.
Yeah. I once treated a marathon runner who swore by them. He said they were the only things that helped him get through his morning training runs.
Wow. That's amazing. Okay, let's shift gears a bit
Sure.
and talk about another pain in the foot.
Yeah.
Plantar fasciitis.
Oh, yeah.
I know it involves that band of tissue that runs along the bottom of the foot, but Can you tell us a bit more about it?
So think of the plantar fascia as your foot's built-in arch support.
Okay.
It takes a lot of abuse every day, especially if you're on your feet a lot.
Yeah.
Imagine you're a teacher who spends hours on her feet. And one morning, she wakes up with this excruciating heel pain. That feels like she's stepping on a sharp stone.
Ouch.
Yeah. This is a classic presentation of plantar fasciitis. Which is basically inflammation of that tough band of tissue.
That sounds incredibly painful.
It is.
You mentioned that this is common in people who are on their feet a lot.
Right.
Is it more common in certain age groups?
You see it a lot in middle-aged adults.
Okay.
Likely due to years of wear and tear.
Makes sense.
But it can happen to anyone, really.
So if you're experiencing heel pain, how do you know if it's plantar fasciitis?
Right.
Or something else?
Well, a doctor will ask about your symptoms, examine your foot and ankle, assess your range of motion.
Gotcha.
They might also press on the plantar fascia to check for tenderness and rule out other conditions.
Now, I've heard that stretching can be helpful for plantar fasciitis.
It can, yeah.
Is that right?
Absolutely. Stretching the plantar fascia and calf muscles is key to reducing pain and improving flexibility. Even simple stretches like rolling your foot over a tennis ball or pulling your toes towards your shin can make a big difference.
So a lot of at-home remedies can be helpful.
Yeah.
But I'm curious what happens when those conservative approaches don't provide relief.
Well, there are other options like corticosteroid injections, which go right into the heel to reduce inflammation. However, they're usually a short-term solution.
Gotcha.
And they don't really address the underlying cause. They also come with some potential risks. So it's not a decision to take lightly.
Right. What about things like extracorporeal shockwave therapy?
Right. ESWT.
Yeah.
It uses sound waves to stimulate healing. And it's non-invasive. Which is appealing to a lot of people. But the research on its effectiveness is a bit mixed. And it can have side effects like bruising or pain. So it's definitely a conversation to have with your doctor. See if it's right for you.
So mixed results with that one.
Yeah.
What about other less traditional treatment options? I've heard whispers about Botox for plantar fasciitis.
Yes.
Is that a real thing?
It sounds strange, I know. But injecting Botox into the calf muscles can actually reduce tension on the plantar fascia. Because it temporarily paralyzes the muscles.
Oh, wow.
The research is still emerging, though. So it's definitely not a first-line treatment. But it's something to keep an eye on.
That's fascinating. I'm always amazed by the innovative approaches being explored in medicine.
Me too.
And of course, there's always surgery as a last resort, right?
Yeah, but it's relatively uncommon for plantar fasciitis. Surgery is usually only considered when everything else has failed. And the pain is significantly impacting your life.
Let's move on to our final foot ailment. Stress fractures.
Yeah.
I think a lot of people might associate stress fractures with athletes.
Right.
But can you tell us more about them?
So stress fractures are tiny cracks in a bone. And they develop over time from repetitive stress. So it's different from a fracture from a single traumatic event.
So it's more of a wear and tear kind of injury.
Exactly. And you see them often in people whose activities put repeated stress on their feet and ankles.
Such as?
Like runners, dancers, and basketball players. Military cadets, actually. They have a really high incidence of stress fractures.
Really?
During their initial intense training. Which suggests that a rapid increase in activity can make a big difference.
That makes sense. Are there other risk factors besides overuse or sudden increases in activity?
There are. Yeah, biomechanics, training habits,
Mm-hmm.
nutrition,
Okay.
even bone health
Gotcha.
can all play a role. For example, female athletes, particularly those with irregular menstrual cycles,
Okay.
are at an increased risk.
Why is that?
Because hormonal imbalances can affect bone density.
I see.
Yeah.
So this is where things like calcium and vitamin D intake become really important.
Absolutely. Strong bones are better equipped to handle stress.
Makes sense.
Now, if you think you might have a stress fracture, pain is the main symptom.
Yeah.
But it can be tricky to diagnose.
How so?
Because it often starts gradually and worsens with activity.
So it's not always a sudden, sharp pain?
Not necessarily. It might start as a dull ache that you notice only during or after activity.
Okay.
You might also have some swelling and tenderness at the site of the fracture.
Gotcha.
Interestingly, the pain from a stress fracture often improves with rest.
Really?
Which can help differentiate it from other injuries.
What about diagnosis? Is it as straightforward as an X-ray?
So a physical exam is the first step. But X-rays aren't always reliable in the early stages of a stress fracture. Okay. Sometimes they don't show up on initial imaging.
Oh, wow.
Which can be frustrating for patients seeking answers.
That is frustrating. So how are they usually treated?
Well, the good news is that most stress fractures heal with conservative management.
Conservative management meaning?
Meaning no surgery.
Okay.
Great.
So rest is key.
So rest is a big part of it again.
Rest is key, definitely. This might involve cutting back on your activity level, changing your workout routine, or even using crutches or a walking boot to completely stay off the injured foot.
What about other non-surgical treatments? Are there any options to help speed up healing?
Some doctors use bone stimulators.
Bone stimulators?
Yeah, they use low-intensity ultrasound or electromagnetic waves to encourage bone growth and repair.
Wow.
The research on their effectiveness is still ongoing. But they show some promise.
That sounds very high-tech. So when is surgery actually necessary for a stress fracture?
Surgery is usually reserved for cases where the fracture is displaced. Meaning
the broken pieces aren't aligned properly, or for fractures that don't heal with those more conservative treatments.
Okay, and I imagine there are some benefits to choosing surgery over non-operative treatment if it's an option.
Yes, surgery can offer a quicker return to your usual activities. A lower risk of the bone not healing properly. And less uncertainty about the healing process. Which can be reassuring for patients.
Speaking of uncertainty, the textbook mentions something called the Saxena classification system.
Right.
Can you explain what that is and how it's used?
So the Saxena classification system is specifically for navicular stress fractures. The navicular bone is a small bone on the top of your foot. That's crucial for arch support. This system helps doctors grade the severity of these fractures based on what they see on a CT scan.
So it's a tool to help determine the best course of treatment.
Exactly. For example, a less severe type 1 fracture, which only involves the top part of the bone, might heal well with rest and immobilization.
Gotcha.
But a more complex type 3 fracture, which affects multiple parts of the bone, could require surgery.
So it's like a roadmap to guide treatment decisions.
Exactly. It helps remove some of the guesswork. And ensures patients are getting the most appropriate care for their specific type of fracture.
This has been a fascinating deep dive into the world of foot and ankle injuries.
Yeah.
I feel like I've learned so much already.
We've covered a lot of ground.
We have, and we're not done yet.
We're not.
Stay tuned, because we'll be back in just a moment to discuss prevention. And what you can do to keep your feet and ankles healthy and happy.
Sounds good.
Welcome back. We've just finished unpacking a whole lot of information about common foot and ankle injuries.
It's a lot.
And I don't know about you, but I'm already thinking about how I can take better care of my feet.
Yeah, it's definitely eye-opening, isn't it?
It is.
We often take our feet for granted.
Yeah.
Until something goes wrong.
That's so true. So let's talk about prevention. We touched on some risk factors earlier, but what are some practical things our listeners can do to protect their foot and ankle health? I'm guessing proper footwear is a good place to start.
You are absolutely right. Shoes that fit well and provide adequate support are crucial. Think of them as shock absorbers for your feet.
I'll admit, I've been guilty of prioritizing fashion over function when it comes to shoes.
Oh, we've all been there.
Yeah.
But you know, it's worth investing in shoes that are designed for the activities you do most often.
That makes sense.
So if you're a runner, for instance, getting fitted at a specialty running store can make a big difference.
So finding the right shoe is key.
Yes.
What about stretching?
Stretching.
Yeah. Does that play a role in prevention?
Absolutely. Regular stretching can help improve flexibility and range of motion in your feet and ankles, which in turn can reduce your risk of injury.
I've heard mixed things about stretching. Yeah, some say it's essential, while others claim it's overrated. What's your take?
I'm definitely in the pro-stretching camp.
Okay.
Think of it this way. When your muscles and tendons are flexible, they can handle stress more effectively.
Okay.
It's like having a well-oiled machine.
I like that.
Yeah, everything works more smoothly.
That's a great analogy.
Yep.
So we're talking calf stretches, toe touches, maybe some ankle circles.
Exactly. Even a few minutes each day can make a difference.
Okay.
You can even incorporate stretches into your daily routine.
Like how?
Like try doing some calf stretches while you're brushing your teeth.
Oh,
And ankle circles while you're sitting at your desk.
Those are some good tips.
Yeah.
And we talked earlier about the importance of bone health.
Right.
Especially for athletes. Any advice for our listeners on that front?
Yeah, making sure you're getting enough calcium and vitamin D is crucial.
Okay.
Those nutrients are essential for strong bones,
Right.
which can help prevent those stress fractures. You can get calcium from dairy products,
Okay.
leafy green vegetables, and fortified foods.
Gotcha.
And vitamin D is produced by your body when your skin is exposed to sunlight.
Okay.
But you can also get it from fatty fish, egg yolks, and fortified foods.
So good nutrition plays a role in foot and ankle health.
Absolutely. It's all connected.
That's so interesting.
What you put into your body affects everything from your bones and muscles to your tendons.
This has been so helpful.
Good.
I feel like I'm already walking a little taller,
Yeah.
knowing I can take proactive steps to protect my feet and ankles.
Yeah.
But before we move on, I want to touch on something you mentioned earlier.
Sure.
About the importance of listening to your body.
Oh, yeah.
Can you elaborate on that a bit?
Of course, our bodies are incredibly good at sending us signals
Okay.
when something isn't right.
Right.
Pain is a big one, obviously.
Yeah.
But you might also experience things like stiffness, swelling,
Right.
or even a change in your range of motion. Don't ignore these signs.
So if something feels off, don't just push through it.
Exactly. Rest is important for recovery.
Okay.
And ignoring those early warning signs can lead to more serious problems down the road.
I see.
Think of it like this. If your car starts making a strange noise, you wouldn't just keep driving and hope it goes away, would you?
That's a good point.
You'd take it to a mechanic to get it checked out.
Right. It's so easy to get caught up in our busy lives
It is.
and ignore those subtle cues our bodies are giving us. But we need to treat our bodies with the same care and attention
Right.
that we give to our cars or our home.
Exactly. It's about respecting your body and its limits.
Okay.
And remember, it's always better to err on the side of caution.
Okay.
If you're experiencing any persistent pain or discomfort, don't hesitate to consult with a healthcare professional.
Okay.
They can help you figure out what's going on and create a treatment plan that's right for you.
It's been a real wake-up call for me.
Yep.
And I hope it has been for our listeners as well.
Me too.
But before we wrap up, I'm curious, what's one thing you wish everyone knew about foot and ankle health?
That's a great question. I think the biggest takeaway is that our feet and ankles are our foundation. They literally carry us through life.
Yeah.
And just like any foundation, they need to be strong and stable to support us.
So we need to treat them with the respect they deserve.
Absolutely. Investing in good footwear, stretching regularly, getting enough calcium and vitamin D,
Okay.
and paying attention to our bodies. These are all simple but powerful things we can do to keep our feet and ankles healthy and happy for years to come.
This has been such an insightful deep dive.
It has.
Thank you so much for sharing your expertise with us.
Oh, it's been my pleasure.
And thank you to our listeners for joining us on this journey.
Yes.
We'll be back next time with another fascinating topic.
It has been my pleasure. And, you know, taking care of your feet and ankles doesn't have to be complicated. A few simple changes can make a world of difference.
I'm thinking back to something we discussed earlier.
Okay.
About the importance of gradual progression when it comes to increasing activity.
Yes.
Can you remind our listeners why that's so crucial?
Sure. Our bodies are remarkably adaptable, but they need time to adjust to new demands. So whether you're ramping up your running mileage, trying a new workout routine, or even just standing for longer periods, it's important to increase the intensity or duration gradually.
So it's like we need to train our feet.
Yes.
Just like we train any other muscle group.
You hit the nail on the head.
Okay.
Think of your feet as athletes in training.
Okay.
They need proper conditioning to perform at their best.
And part of that conditioning involves choosing the right shoes.
Yes.
As we talked about earlier.
Right.
It's so easy to forget how much impact our feet absorb every day.
It's true. We often don't realize how much we rely on our feet until they start to hurt. And that's why finding supportive, well-fitting shoes is so important.
Okay.
You know, they can really help cushion the blow and protect our feet from injury.
I'm curious, do you have any tips for choosing the right shoes. It can be so overwhelming with all the options out there.
It can be, yeah. My biggest piece of advice is to think about your specific needs.
Okay.
What activities do you do most often?
Okay.
Do you have any pre-existing foot conditions?
Okay.
Once you have a sense of your needs, then you can start to narrow down your choices.
So a marathon runner is going to need different shoes than someone who primarily walks for exercise.
Exactly. And don't be afraid to ask for help.
Right.
A good shoe store should have knowledgeable staff who can assess your foot type and gait.
Okay.
And recommend shoes that are right for you.
That's helpful advice. I think a lot of people just buy shoes based on how they look.
I know.
Without really thinking about the support they provide.
I see that all the time, and I understand the temptation. There are so many stylish shoes out there.
Right.
But when it comes to your foot health, function should always come before fashion.
So true. And I'm also thinking back to what we discussed.
Yeah.
About the importance of calcium and vitamin D for bone health.
Right.
Are there any other lifestyle factors that can affect our foot and ankle health?
Maintaining a healthy weight is important.
Okay.
Because excess weight puts additional stress on your feet and ankles, increasing your risk of injury.
That makes sense. It's like carrying around extra baggage all day long.
Exactly. And if you smoke, quitting is one of the best things you can do.
Really?
For your overall health, including your foot health.
Interesting.
Smoking restricts blood flow.
Okay.
Which can impair healing and increase your risk of complications.
So there's a connection between smoking and foot health.
Definitely, it might not seem obvious.
Right.
But smoking can really affect your circulation, which is crucial for healthy feet and ankles.
This has been such an eye-opening conversation.
It has.
I feel like I've learned so much about a part of my body that I often take for granted.
Me too. And that's the beauty of it, isn't it?
Yeah.
The more we understand about our bodies, the better equipped we are to take care of them.
Absolutely. Well, thank you again for joining us on this deep dive.
Of course.
Into the world of foot and ankle health.
My pleasure.
We hope you've learned some valuable tips.
Yes.
And gained a newfound appreciation for these amazing structures that keep us moving.
Yes, they do.
That's all for today's deep dive.
Okay.
Thanks for listening, and we'll see you next time.
Sounds good.